So let's get going. I'm really delighted that Mark and Ashley have been able to join us today. Mark is Director of the Applied Research Collaboration in the Northwest Coast, and Ashley is Director of the School for Public Health Research, both funded, of course, by the National Institute for Health Research. And it's a collaboration between ARC Northwest Coast and SPHR that's enabled us to produce this resource for the health research community. So Mark's going to start us off. Thanks, Mark.
Thanks, Jenny. And it's a great pleasure to be invited to launch this with my colleague, Professor Anderson and Professor Pope. It's a really exciting opportunity. The For Equity resource and website has been much awaited, and I'm sure you will agree with me when you hear about it today and start to explore it, what a fantastic addition it is to our resources as researchers, and something to very much share with our colleagues. It's when we set out in the Clark, Jenny and I, a number of years ago, we realized quite early on that if we wanted to really focus on health inequalities, we needed to develop a toolkit that would enable researchers to think about health inequalities in a systematic way, and in collaboration with members of the public to be able to think about what the health inequalities issues were and how to integrate them into all elements of a research project, not just in the design of the project and the grant application, but also in its delivery and in its subsequent dissemination and implementation. So that's where we started in Clark. And that worked well once it was embedded, and it takes time to embed, but we also realized that it was restricted in scope and it needed more time and work to develop it. So I agreed with Professor Pope and colleagues in the National Institute for Health Research School for Public Health Research that we would work together from our ARC Northwest Coast on developing this For Equity website and an enhancement of the Health Inequality Assessment Toolkit that we developed. And that's what we're here to launch today. And it is a real step change, and very many thanks to the hard work of Jenny and Anna in particular. Unfortunately, we realized with Clark that when we tried to look for any information about the impact of research findings or an initiative on different elements of society, that sort of health inequalities information either wasn't collected, or if it was collected, it wasn't reported. And so the whole point of this is to change that so that we know more readily when somebody's done some work on health and social care, does this increase health inequalities? Does it decrease health inequalities? Or does it have a mixed pattern? Or does it have no impact? And unless we collect those data, we'll never know, and unless we think about how that might work. And that's what this is all about. And I think things are improving, but there's still some way to go. And I think, as I said, this is the step change that will help us to do that better. And I'm not going to talk very much longer. I really think what we want to hear about today is the project and the product. And so I'm going to hand over to my colleague, Professor Ashley Anderson, to talk about this from the School of Public Health Research's perspective.
Thank you very much, Mark, and I'm very much delighted to be here to welcome you all to this launch event, and also to celebrate the work of Professor Pope and her colleagues in actually making sure that this could happen. So I'm here to welcome you on behalf of the NIHR School for Public Health Research. And just a little bit of background to add to what Mark has said about the ARC, and that NIHR, the School for Public Health Research, is given priority to research that's relevant to health inequalities right since its beginning in 2012. And Jenny has been involved in championing this really important work throughout that time. So in the past 10 years, we've had 2 programs focusing on health inequalities. And the good news is that the school has just been renewed through to 2027. So we know that we have secured funding up until that. And in the next 5 years, we're going to have an increased focus on health inequalities, with a dedicated programme on that, and also looking to have a health equity lens across all the work that we do and across all of the research. And this tool is going to be a real boon into helping us to achieve that. So it's imperative that as we work on public health research and produce the evidence, that it is created with maximum relevance and can contribute to reducing health inequalities. So I see this 4Equity tool, as Mark's already mentioned, is a really great example of some of that NIHR cross-working and synergy between the ARC Northwest Coast and the School for Public Health Research, all funded through NIHR, but also a tribute to the dedication of Jenny and her colleagues to make sure that this can happen, and building on the HIAT tool was its beginning. So 4Equity, I think, can make a major contribution to all of our research in the ARCs, in the School for Public Health Research and beyond, by supporting the researchers, and also to make sure that whatever we do can have maximum impact on reducing health inequalities. So we're just on the start of the next journey of the next 5 years for the school, and this is really timely that we have this right at that time. And Jenny, along with her colleague based in Fuse up in the northeast, Claire Bamborough, will be leading on our health inequalities programme and helping us develop that over the next 5 years. So that's all I think I needed to say today, Jenny. I think we need to get on to actually see what all of this chat's about and see the tool in action. So back to Jenny. Thank you.
Thanks very much. Thanks, Mark. Thank Ashley. So you've got us going. Just to say, there was a large team, as both Mark and Ashley have said, involved in producing this. Too many to name, but it was both the ARC and the school. So it's not just Jenny. I'm fronting it with Emma today, but on behalf of the team. So let's get going. You're going to see a series of videos rather than lots of live presentations. Partly, we thought that would help us to keep to time. I have a reputation of talking a lot, so but also it's a bit more reliable to do it this way. So I'm going to share the screen now and take you through a demo of the site, and then you'll hear from Emma as well. And after that, we've got some perspectives from potential users. Hi, I'm Jenny Popey, Lancaster University, and on behalf of the team, I'm going to take you on a tour of the 4Equity web resource. But before getting into the site, I want to make 3 general comments. So the first point is that, as Ashley and Mark have highlighted, 4Equity has been designed to support people involved in research to strengthen the equity focus in their work. Now, we're not arguing here that everybody should do research on health inequalities, but what we are arguing is that all research in the health field, and indeed in other fields, should have an equity lens applied to it, so that the evidence that's produced, the findings, have the potential to contribute to action to reduce inequalities in the experience of health and well-being, to reduce inequalities in access and ability to benefit from health and social care. Secondly, the 4Equity resource builds on something called the Health Inequalities Assessment Tool, which some of you may know and have used. Just however useful people found the HIAT, we were aware that it had one very serious limitation, and that was that it was quite narrowly focused on socioeconomic inequalities in health. So other major dimensions, axes of inequality that contribute to health inequalities were missing. So, for example, gender and sexism, ethnicity and racism, disability and disableism, age and ageism, and other axes. So we decided to revise the HIAT to integrate this intersectional lens. But while we were doing that, we also saw it as an opportunity to extend the HIAT to add other resources, and I'll show you those as we go through the site. And third, and finally, it's quite important to point out that For Equity is not a how-to manual. You won't find on this site practical ways and methods for integrating a lens spelt out in detail. Rather, it's been designed as a space for people involved in research to reflect on how an equity lens can be applied to their studies in their particular context. So there are questions with resources linked to those questions to help people think about that. So let's have a look at the resource. And just to say, there's a lot of material on there. So this is not going to be a detailed tour. It's rather an overview of the structure of the resource, and I'll show you some of the material that's on there. So let's look at the For Equity web resource. This is the landing page you can see here. We've tried to keep the text to a minimum. So it just briefly introduces the idea of an intersectional perspective on health inequalities. And there's a link here to a very useful short video made by the Department of Sociological Studies at Sheffield University on the relationship between intersectionality and health, which is also included elsewhere on the web resource. The carousel has got some illustrations of the way in which these intersecting axes of inequalities generate differential health outcomes. So, for example, people with learning difficulties have a shorter life expectancy than the national average, but amongst people with learning difficulties, women and people on low income have shorter life expectancies than the group average as a whole. And then here you've got the three main parts of the website. These can also be accessed at the tabs at across the top. So there's the Hyatt Toolkit, a For Equity Resources Library, and a For Equity Guidance Inventory. I'm only going to focus on the Hyatt and the library, and Emma Halliday, a colleague, will be demonstrating the inventory to you. So let's look at the Hyatt. The Hyatt, immediately the landing page shows you the 5 sections of the Health Inequalities Assessment tool. The first 4 sections are focused on the same issues as the original Hyatt. The 5th section, focusing on the idea of equity-sensitive research practice, is new. So the sections are, they don't have to be followed in a linear fashion, but they are set up along a kind of linear idea of the research process. So the first is reflecting on the health inequalities dimensions of the topic you want to study. Now, obviously, all researchers will know about the topic they want to study, and as we get more experience, we know more about it. But maybe you don't know enough about the equity dimensions of that topic. So actually mapping that out is the foundation for integrating an equity lens throughout the study. The second section of the Hyatt focuses on integrating an equity lens into research questions, and that will help ensure that equity is central to the design, conduct and reporting of your study. The third section is about designing and conducting research sensitive to health inequalities. And that, of course, requires attention to what data you're going to use, how it's going to be obtained, how it's going to be analysed, how the findings are interpreted. And then the 4th section looks at how findings relevant to action on health inequalities are embedded in reporting and dissemination. If they are prioritised, that will maximise the positive impact of your research on action to reduce health inequalities. And then the 5th section, as I've said, is focused on this idea of equity-sensitive research. In the first 4 sections, as you will see in a minute, they're structured in the same way. There's part 1 is about reflecting on how you embed an equity lens in that particular area. Part 2 is about involving people with relevant lived experience and other stakeholders. We all know that in the health field, at least, the importance of doing that and the value of doing that. But the focus here, perhaps less commonly, is on how people with lived experience and people with professional expertise can help you think about the equity dimensions of your study. And then finally, there's a part which we've referred to as Dive Deeper for those people who want to know more about the issues, and there are links to additional resources which are on the site, or it may take you to other sites. So let's just have a quick look in a couple of these parts. So the mapping, the structure is the same in each of them. There'll be first, there's a brief explanation of the purpose of this part of the Hyatt, and then there's the three sections: reflection on the issues, reflecting on who to involve and how to involve them, and then the Dive Deeper section. So here, in terms of mapping the inequalities, you're encouraged to think about the context for your study by thinking about which groups, if any, in specific social categories, by gender, by ethnicity, by age, by experience of disability, are differentially affected by the issues you plan to study, and what factors, individually or in interaction, may have caused these unequal experiences. What is known about those factors, and what sources of knowledge will help you to find out about these dimensions of inequalities. Now, of course, you know that information might be limited in the field in which you want to study. So that's where the importance of involving lived experience experts and professionals come in, because it's not just a question of who to involve and how to involve. Those are issues that are raised here. But the key for this resource is what equity issues do people with lived experience and other expertise priorities, so they can fill some of the gaps in the published literature and grey literature. And then finally here, you've got the Dive Deeper, and there are some links both to outside resources. So here you've got Transgender Health Justice Framework, a link to an external website, which may come up. Yes, there you go, with the paper. And here there's a link to one of the case studies in the library. Let's have just a quick look at another one. So prioritizing research findings, same structure. The purpose on the back of the reflect tile. There are actually here 4 areas of reflection, issues that you are encouraged to reflect on. So the first is building a focus into your recommendations. And there's a link here to a case study in the library, which is a very interesting example of how equity sensitive recommendations can be developed. And then the second area of reflection is how to avoid negative impacts from research reporting. Inadvertent, absolutely, but nevertheless, for example, research can add to the burden of stigma experienced by people bearing the brunt of inequalities. And we give some examples here of how the way in which language can do that. Many of you will be aware of this, but too often we unthinkingly attach the problem as a characteristic of the people. So poor children, homeless people, rather than as a characteristic of the context in which they live. So here there are, so for example, poor children eat less fruit might be reframed as children living in poverty eat less fruit. Homeless people have higher smoking rates could be reframed as smoking rates are higher amongst people who are homeless. And there's a link here to a website which is focused very much on gender, which gives lots of examples of the way in which not just the words we use, the language we use, but the way we present data can be made less stigmatizing. And then a third area for thinking about dissemination and reporting that is equity sensitive is how we can make the structural causes of inequalities visible, more visible in reporting. So not just focusing on behavioral issues or lifestyle issues, but on the root causes of behaviors that are potentially health damaging or on the structural limits that stop people from adopting healthier lifestyles. And then finally, thinking about how our research findings can be made accessible to all audiences. And here, for example, there is a link to a website which shows this little booklet that has been produced to in collaboration with communities involved in the research to make the findings of the research more accessible to those communities. So that's the Hyatt. What about the library? So you've seen that actually links to material in the 4Equity library are embedded throughout the Hyatt, and we'll be doing more of that. But the library is divided into two sections. There's the Hyatt resources, which are a set of case studies of research that has sought to integrate an equity lens into some aspects of the research or all of the research. And then there are general resources. So the Hyatt resources are grouped, these case studies. They're mini case studies. They're with a link to the actual paper. They're grouped according to the Hyatt sections. And some of the case studies may be relevant to more than one of the sections. So, for example, we have case studies that illustrate how one can make the research questions more equity sensitive and how the recommendations can be equity sensitive. So where that happens, we have repeated the case studies in the different sections. At the moment, we don't have any case studies for section 5 of the Hyatt, but we're getting there. So if you click on this, you'll see a set of case studies. And the case studies, as I say, are relatively short. So here's a case studies looking at barriers to participation in a weight management program faced by people with intellectual disabilities. And we explain why it's here. And then there's a very brief summary, really, of the paper with the reference and a live link to the paper. And the general resources library, you can just click back, as you can see, we're trying to avoid duplicating what's on other websites in other places. So we don't go into any detail about the resources on here. They've been structured under these headings here, as you can see. So it starts with a couple of resources around intersectionality and health. And there's that lovely, very accessible video from colleagues at Sheffield here. But this will save you, perhaps. You can scroll down and look through all the resources, or you can go to one of the, you can see where the headings are. We're generally looking for users of the resource to provide us with additional general resources, references, but also examples of papers or pieces of research that we can turn into case studies. We also want you to tell us about any gremlins that you find on the resource, things that you like about it. So there's a contact us page here that for you to do that. So that's the 2 of the 3 main sections of the web resource, and I'm now going to hand over to Emma Halliday, who is going to take you through the inventory. Thank you.
My name's Emma Halliday, and I'm part of the 4Equity research team based at Lancaster University. In this short video, I'm going to provide a brief demonstration on how to use the guidance inventory on the new website. To do that, I'll just share my screen so we can access the 4Equity site. Once on the homepage of 4Equity, you can access the guidance inventory by clicking on the relevant link. The inventory is based on a systematic review of resources available in the public domain, such as tools and guides aiming to strengthen the equity focus of health research. The information on the inventory section provides some background about the inventory and also how to use the inventory in practice. There are three main ways of searching it, which I'll talk through now. The first way of searching the inventory is to browse through the 22 resources contained in the inventory. And you can do that by hovering over the tiles displayed on the page. If you click on a tile, this takes you into a short template which provides some further information about the resource, such as its use in the research process. On this tile, there's also a link that allows you to access the full text of the resource. And you can do that through the link at the bottom of the tile, but also by hovering over the title of the resource, which provides a hyperlink to the full resource. Then to exit the individual tile, just click on the small cross. The second way of searching is to filter by social category in the filter row. So for example, if I click on intersectional, this brings up 10 resources which discuss the ways in which intersectionality can be considered in research. Then to remove that filter and return to all resources, click on the lozenge called Remove All Filters. The final way of searching is to conduct a free text search. So by typing systematic reviews, for example, this brings up 4 resources which have particular relevance to developing and undertaking systematic reviews. Then again, to remove that filter, click on the lozenge. Over time, we hope to develop the inventory, so please feel free to send us your suggestions of new resources we could include in the inventory. And you can do that by contacting us via the contact details on the For Equity website. Thank you. Thank you. We hope you found the demonstration a useful introduction to the website, and Harris has just reposted the website link in the chat if you want to have a look at the live site. So for our next slot, I'm very pleased to be able to introduce 3 perspectives on potential users of For Equity through the eyes of its users. The first perspective comes from Professor Margaret Whitehead, based at Liverpool University. Alan Griffiths provides our second perspective. Alan is a public advisor to ARC Northwest Coast, as well as a public partner in SBHR. And Alan, as well as Rod, who are members of the team, were public advisors and heavily involved in the development of For Equity. And the final perspective comes from Mark Green, also based at Liverpool. Jenny, can you please play the videos?
Hi, Margaret. Thanks very much for agreeing to speak to us. You're Professor of Public Health at Liverpool University and obviously have an international profile for your work in health inequalities. In For Equity, in the library, we have a couple of papers that you and colleagues wrote to encourage people to strengthen the equity dimension of randomized controlled trials. Just wondered if you could tell us what inspired that work? Why you and colleagues produced those papers?
Well, hi Jenny, and thanks very much for inviting me to the launch. Yes, those 2 papers you're talking about were done with the Campbell and Cochrane Equity Methods Group. So it's a group of international researchers who have been thinking about this issue. And we're very aware that randomized trials, they provide evidence on the impact of an intervention. And in principle, they also assess the impact on health equity. But randomized trials often fail to report relevant socio-demographic factors as a start. They don't collect the evidence that you would need, and then even if they do, even if they're appropriately powered to do subgroup analysis. They rarely conduct analyses to assess whether the impact of the intervention differs across different social groups in society. So they could look at differential impact by socioeconomic status or deprivation of area of residence or ethnic group, but they rarely do. And so that, we actually, one of the papers is a systematic review of health equity considerations in cluster and individually randomized trials. And that showed just how poor the reporting was and the lack of the analysis. So that led us to reflect on what we need, and did we need additional guidelines for RCTs that had the potential to provide useful evidence? Did we need further guidelines? Did we need a conceptual framework that would help researchers? And so that's what we set about doing. And the second paper actually presents a conceptual framework. We hope that that will help other researchers and systematic reviewers build greater consideration of equity.
Yeah, that's great. And the papers, I'm sure, are going to be a really useful resource because of this. They're clearly supporting others to do that. So I just wondered if you could say a few words about how you think the 4 equity resource, you've obviously not been able to look at it in detail, but a brief review of it, and you've been involved in discussions about what it will be, of course, through the School of Public Health Research. So I wonder if you could just say how you think it could help people to strengthen equity, whatever their research, really, to strengthen that lens.
Okay, well, I think that there's 2 major advantages to it. First of all, it's the tools and the resources that it provides, and a pathway through all those resources to help researchers who want to have a stronger equity in their research, whatever they're doing, whatever research project they're doing. But equally important, I think it's the space that the For Equity provides, the space for like-minded people to reflect on the questions that are posed in this systematic way of looking at studies. I think that is very important indeed, that we need more resources like this that bring people together and helps them reflect on their research and their purpose.
Thank you very much, Margaret. That's really great.
So wish the initiative all the best.
Thank you. Thanks very much indeed. And we'll let you know how we get on with it, with people using it. Thank you.
Hi, Alan. Thank you for taking time to talk to us today. So you are a member of the public who has joined our work in ARC Northwest Coast, helping out with SPHR. Can I start by asking you what sort of background experience you bring with you? What interests you in the work around equity that you've been doing?
Well, I'm the father of a young man with a learning disability and autism and 1 or 2 other complex issues. And I've always been very aware that people like him tend to have a shorter lifespan than the rest of us. And because of that, I've always been really important in this health equality question. And in fact, I joined the Health Inequalities subgroup at Clark prior to ARC coming along. As you know, I'm part of that as well now. So that's where my background comes from.
And you've been working specifically to help co-develop the For Equity, this new web resource that we have. What made you feel it was important to contribute to this and give your time for this?
Well, I was asked to join that shortly after ARC began, and Jenny, I think, in the SPHR started talking about this group. And well, to put it, I had a couple of issues, if you like, in the first one. And the first one was the word equity as opposed to equality. This is before the 4 equity groups started. And I had one of those light bulb moments when it suddenly dawned on me, it isn't about equality, it is about equity. Because in the past, we've always talked about health equality being the opposite of health inequalities, as you would. But that's about creating a level playing field. And when you get people, for example, like my son, are very vulnerable people, and there's a lot of them, people who don't speak it, people who can't access the NHS, for example, then a level playing field is no good. You've got to do that extra bit and create the equity. So that was the first thing. And I believe that, very much believe that that's the case. And I know the rest of the team do as well. The second one was social determinants. And I've always thought that's not the whole story. That is not the only reason why we have health inequalities in the first place. So that's where, if you like, the HIAT has changed, and I'm delighted with the new HIAT, because the new HIAT does talk about intersectionality. Intersectionality, however, isn't the easiest concept to understand, but nevertheless, it does go a lot further in terms of describing the reasons and the causes for health inequalities.
And so, thinking about 4 equity as a resource, how do you think that can be helpful or important to have? What difference can it make?
There are in fact a lot of resources within it, and I think within time, I think that the site will grow. But the first one at the moment, the most important one, I think, is the HIAT. Most important for me because I think it helps people who are starting out in doing some research to do with public health or applied health or whichever, helps them to look at the whole thing with through an equity lens, and helps, I hope, in time to embed the whole equity, health equity in everything people do. Not overnight, but in time. I'm very hopeful that will happen.
Fingers crossed, we're hopeful too. Thank you, Alan. It was great to hear your perspective as a member of the public. Thank you.
So, Mark, thanks very much for agreeing to have this conversation with me. I know you're a reader in health geography at Liverpool University, and that you've attempted to integrate an equity lens into your research. So, could you tell us just a bit about why that was important for you, maybe about the research you're doing?
Absolutely. So, I believe that we need to be more inclusive in how we do research, and make sure that all voices are heard, or at least represented in how we design research projects. And that could be both in when we're coming up designing research projects, whether that's for grants or for before we start them. It's in how we design our study teams, who we collaborate with, who we engage with as stakeholders, and indeed in how we undertake our analyses. And I think when we study health issues, many of the kind of exposures or outcomes that we're interested in aren't always equally distributed across our communities. They often disproportionately affect diverse and disadvantaged groups. So we need to be doing a lot more to understand why this is the case, and what we can do about it, which is really often the important part of it. And, for me, it's all about the social gradient. The social gradient is so powerful, it has such a considerable impact on our lives. So all health issues are really equity issues. So we need to be integrating these issues into everything that we do. And I think that's why 4 Equity is such a great tool, because it's about how we can start having those conversations in how we do research to make sure that equity issues are front and center of research.
So we have a little case study of one piece of your work on in the 4 Equity library. And I think that's a really interesting example, because what you were doing there was looking at a measurement, rather than the design of a study or something. So I wondered if you could tell us a bit more about what stimulated you to do that. Tell us what you did, and then maybe what stimulated you to focus on that particular.
Cool, thank you very much. So the specific case study that's on the website is a project we did around obesity. In particular, we approached it from a view that not one size fits all, and we're thinking around the impacts of excess body weight. And really, we just need to move away from just thinking around classifying people based upon their BMI alone, and actually start to think around the different communities who are affected by some of these issues around excess body weight and some of the health implications associated with that. So, for example, how do the experiences of obesity vary across young and old populations, males and females, across different ethnic communities, or even by different levels of socioeconomic deprivation? And if we, continue down a kind of one-size-fits-all approach to how we're trying to design either interventions or research, then we're never really going to really account for these differences in experiences across all these groups. And by treating them all the same, we disregard their unique circumstances that don't apply to every group, and we end up with a kind of less ideal situation. So it's nice to be featured on the website. I don't think we did things perfectly in trying to build equity into that, and I think there's definitely ways in which we can go forward and improve upon what we do. But for me, I think it'd be really nice if research can start having these questions and conversations around who is affected most. How does that kind of complexity and diversity in experiences vary across our populations, and start to move beyond understanding more granular ways in which people are impacted by inequalities.
So it's a reciprocal kind of appreciation here, because thanks very much for what you said about the 4Equity resource. You've not had very much time to look at it. I know people have been helping us just by reviewing it. I wonder if you could, because you're somebody that's already thought about these things and started to integrate it, how do you think the resource, the 4Equity, could help you in the future and maybe other researchers?
Well, I think 4Equity is great. Let's start with that. And I think what's really good is it's about starting those conversations about how we can better integrate an equity lens into how we do research. And importantly, I think the tool is really good because it's there to help people of all different levels of confidences in taking an equity or an inequalities approach. So they're useful for people who've never done this before, and it's useful for people who have a lot more experience in doing this work. The tools on the website, they're really good at guiding you through what questions you need to be asking yourself or your collaborators when we design research. And I've used the Hayat tool quite a bit, and I think it's really good just as a starting point to prompt conversations with either stakeholders, with my collaborators, with patient and public groups, better to get into what's important to you and how can we build these equity issues into research. Where I think 4Equity is really great is because a lot of research, and particularly public health and health-related research, when it deals with kind of equity and inequality issues, they're almost kind of tokenistic. So they might just be an analysis where we stratify for level of deprivation, for example. And I think that's just not good enough. We can do better with that. And we need to incorporate the complexity of social identities, engaging with things like intersectionality, into how we do research. It's really hard to do that. And I think 4Equity is great at starting that conversation, starting the process of how we can build in more diverse voices and have better representation for different groups in how we do research.
So, Mark, thanks very much. We've run out of time, but I really appreciate your contribution and look forward to hearing how your experience of using it in the future so that we can keep improving it. Thanks very much.
Thank you.
Thank you. I hope you found the introduction to the website helpful, and those perspectives on how people have found it helpful for them, and and that you'll use the site. So I've not been able to look. Is Emma going to join me now for to see if we've got some questions, and whether you've had a chance to have a quick look through they're mostly really helpful comments, really interesting comments.
Yeah, I wondered, Jenny, if you could say, so Timothy Wilson has posted a couple of really interesting points. So the first point was about the ways in which the For Equity tool considers of upstream determinants, so talking as well about sort of social justice, human rights issues, and social models of health.
Yeah, so from the beginning, the Hyatt has had that structural perspective, and I think we have tried to keep it and strengthen it in For Equity. So part of the perspective that's offered in For Equity is not just to build an equity lens, but to build a particular kind of equity lens. And I suppose the two core aspects of that are the intersectional lens. So we're not just focusing on, in our research, on socioeconomic inequalities, absolutely foundational as they are, those that we're looking at how those inequalities intersect with others. But then the other element of the equity perspective that For Equity is trying to support is this perspective on the structural determinants, what are sometimes referred to as the upstream determinants of health inequalities, what the Marmot Commission on Health Inequalities talked about as the root causes. So, there is a tendency for health research to focus on behavioural, from the kind of proximal causes, the behaviours that are health damaging or aspects of lifestyle. And what For Equity is saying is, but don't forget the context. If you're going to be looking, if you're going to introduce an equity lens, don't forget that context, that the equity lens must look at the root causes of those behaviours and lifestyle difficulties.
And I've just seen a question from John Dean, who is interested in how we might adapt this approach and information for service improvement and service evaluation. So I guess that one of the purposes of this site, it has a specific focus on research, because that was where there was potentially a gap in resources around health equity. But do you ever have any sort of views on that, Jenny, around the way in which perhaps a Hyatt could be used more broadly?
I'm not sure if Mark is still with us, but the Hyatt in the ARC, and I think still in the applied research collaboration, is used by practitioners as well. So it is very strongly focused on research, but I think it can be used in a multidisciplinary perspective. Mark's there. Do you want to?
Yeah, I think there's the Heat as well as the Hyatt.
Yes.
And I think these are, at the end of the day, these are adaptable resources for people to use in different ways in different settings. At the moment, nobody outside, for example, the ARC and the school is requesting one formally to be submitted as part of a grant proposal. We're hoping that we will start to persuade NIHR to make it strongly encouraged, for example, to do that. And I would still argue, with my research design service hat on, that when people are writing research projects, that going through the Hyatt and using this new website will substantially enhance their chances of getting funded, because of the ideas that it brings through and the thinking that it promotes. But yes, in any sort of service evaluation or quality improvement project, thinking about equity is essential. I was working with Vanguards, and I realized that the trusts were making changes to their whole system of patient workflows and didn't actually record postcodes of people who were being referred into the system. So they had no way of knowing whether or not their new access was making it easier or harder for people, for example, from higher deprivation areas to actually get into the system. So I would strongly encourage colleagues, whenever they're doing anything like this, to make that part of their routine data collection. Just some simple elements of equity in the For Equity website would certainly help people be able to do that and to build into their routine evaluation of change and innovation.
Thanks, Mark. There's a comment from Amy Russell, a question. I wonder if Ashley's still there. I think she is. Ashley, Amy's asking how we make sure that this kind of resource is integrated into all research planning and not just a tool for the people who are already who are already integrating equity.
Yeah. Thank you, Jenny. And I think, there's a little bit of in all of this in terms of carrot and stick, if that's an expression I can use. And that I think that one of the ways is, as I think Mark's already referred to, is actually making that assessment and use of the HIAT and consideration of for equity information as part of an application or a part of proposal stage. And this is something that we certainly have been doing within the School for Public Health Research, as people have been planning their research. If you make it that a requirement that at least there's that consideration and the use of the HIAT, and I think that this will be enhanced by the for equity, then that happens and then it becomes integrated. So I think Mark just referred to that being possibly something that NIHR more widely can adopt, and it doesn't have to be onerous, but it is really an important aspect that we all consider. And I think just making it part of research proposal forms is an important step to make sure that people actually seek it out and then use it. That's the, Margaret says, if you don't know it's there, how do you use it? So making it part of the form, putting the links in, and then asking people to do that before they submit is an important step.
Mark, did you want to add something briefly? Because there's a couple of other comments I want to get to.
Briefly, yes. I've looked at the other comments. I think there are more comments and questions. So I think I made the point earlier, but this isn't a one-off. It's never meant to be. It's a process. And one of the challenges we had in Clark when we first introduced this is that colleagues understandably said, well, I've done the HIAT now. Where actually this is it's a living document, and the intention is that one returns to it and says, how are we progressing? Does it need changing? Have we met those intentions? Do they need adjusting? And it keeps that spotlight on equity throughout the process. And just adding to Margaret Whitehead's presentation earlier, we actually did, we had a Clark PhD that also did work on how in systematic reviews, you can make the best possible use of what information there might be about health equities when you're writing a systematic review report and trying to collect on that. So there are other resources around that we can use, and toolkits have been put together, but it is a process. It's not a single thing, but we will keep working with NIHR and other colleagues, but I just think it's a good discipline. Whether or not it's a requirement, and the more we can get that embedded, the better.
Okay, thanks very much, Mark. We've got a comment from Lubina Mirza, which I think is worth acknowledging. And Lubina was saying that just watching videos, we could have presented the videos before and had a more interactive session. I think the problem, Lubina, if you're still there, is that we've had several hundred people applying to register. I think 100 and there was certainly 100 and something joined us, which would have been a bit of a large group for interactive sessions. So, but we will have smaller sessions in the future, I think, through SPHR and the ARC, where we can have more interactive discussion about the for equity and how it can be used. But today, as you saw, just getting the videos working was defeating my technical ability. So having an interactive session with 140 people, I think would probably have defeated me. So I think that's the other comment I wanted. I'm not sure, Emma, whether you have, but Margaret Wolf from Rhodes University in South Africa makes a useful point, I think, which we've talked about in the team, Margaret, that although the focus of for equity has been health, public health research and health services research, of course, health is not just about healthcare, social care. It is about housing, it's about water, it's about income, it's about the environment in general. And thank you for your comment that I think actually the website and the resources on there will be helpful to people who are not in the health field, who do not identify as being in the health research field. And we very much hope that it will be, and we will be adding resources to the library, to the case studies that are from outside the health field but relevant to health equity. Emma, was there anything else you?
No, I'm just looking through. I think those all the comments and questions. But obviously, if I think we're out of time now, so if people do have questions which haven't been addressed, please get in contact.
Yeah, please do. And thanks very much for joining us. To Ashley and Mark for live presentations of the people who agreed to be videoed. And please do use the site and send any comments that you have on the site or on the launch today. Thank you. Thanks, everybody.
Thank you.